care continues to soar at double-digit rates each year. My wages have gone down the last 2 years. Let's see, and as a final comment, I'd like to say that let's pursue and not neglect educational alternatives, because it's going to take a great deal of education to make this problem better. I want to thank you for including us in the conversation and hope that you will continue to include us in this conversation, as again, our population is 36% of this state of California, and the Hispanic Chamber is one of the few independent voices, and I drove 300 miles here on my own to tell you that. Thank you.
Thank you. I also drove a distance. Thank you. Okay. Yes.
Good afternoon. My name is Cristina Cardenas. I'm an organizer for the Healthy Eating Active Communities Initiative in Baldwin Park. And I'd like to thank you all, Senator Dean Flores, Senator Alquist, and Alex Padilla, for hosting this hearing today. Just wanted to let you know that we are so pleased to be part of this hearing today. I wake up in the morning and do my job as organizer because the fact remains that there are healthy foods that are hard to find in certain communities, such as Baldwin Park. And we have seen through studies, through the American Journal of Clinic Nutrition, and being present in communities themselves, that, such as Baldwin Park, that retailers in low-income communities are less likely to sell healthy foods and beverages, such as fruits and vegetables. These small independent owners are pressured by industry to locate certain foods and beverages in certain parts of their stores, and their hands are tied as far as what options they are able to sell to community. So these residents many times find themselves in communities where the supermarkets are moving out and find themselves going to liquor stores and corner markets for their food, and finding that these stores are likely to sell highly sweetened beverages and foods, and selling those products in excess to milk and water. So given the pressures and given the community perspective, my job has allowed me to really talk to youth and residents on creative solutions, and we really are in support of a tax that will really help to provide these hardest hit communities resources and funding to really address the obesity epidemic. Thank you.
Great, thank you.
Hi, good afternoon. First of all, I want to thank you, Senator, for your interest in this problem that is affecting our community. I am a Baldwin Park resident, and I want to let you know that as a mom, I feel really sad that in stores, we have to pay more for healthy drinks because sodas are cheaper all the time. And if we as a moms have to bring to our homes all food, I know many people are going to make wrong decisions for money reasons, especially in these times. I know education is important. That's why I have been involved in a group that teach me how to make changes in my community. And thanks to that, I see positive changes in my schools and city and some stores. And I know kids have more healthy choices in vending machines. That way we have the opportunity to talk to many stores, and they give us the opportunity to make some labels so that way people know how to have more healthy choices. And that's my experience, and thank you for your...
Thank you.
Thank you.
Thank you.
Good afternoon. My name is Elizabeth Medrano. I work at the Center for Food and Justice with the Healthy School Food Coalition. This is at Occidental College, and I work basically with parents and students at LAUSD school sites to inform them and really gain their support for the compliance of the various food and nutrition policies that the district has passed. And a couple of recommendations that I would like to share today would be, one, to look into the Farm Bill. This is a federal bill that comes around every 5 years, but really to look at the decrease for funding that goes to corn crops, because most of that corn turns into syrup. That's really invaded our food supply, not only in sodas and other drinks, but it's in every food, or most of the foods that we have at the market. Another suggestion would be to really support all policies and proposals that come to your desk at the state level to really turn water into the beverage of excellence at schools and everywhere. I personally, and my organization, I believe so, that we do not support water privatization. And in my opinion, having a bottled water is really depriving some people from having access to it. Water is for all, in my opinion. We shouldn't be buying it. And lastly, this is a personal opinion also, and that's why I'm here to share it, is that it also creates pollution. So it's not only polluting our bodies with the intake of these beverages, but the plastic that we are really throwing. I know there are many recycling programs, but at the end of the day, we don't really need these kinds of products. Thank you.
Thank you. That's good.
Good afternoon. My name is Nikki Basford, and I'm with a nonprofit called Community Health Councils here in South Los Angeles. We do a lot of health promotion, advocacy, and policy work. Our community, South Los Angeles, has disproportionately high rates of obesity and obesity-related chronic diseases, including diabetes and cardiovascular disease. Unfortunately, maintaining a healthy diet for residents in South LA is difficult because our community is saturated with fast food outlets, convenience stores, and other places that sell nutrient-poor, calorie-dense foods, including sodas and other sweetened beverages. Healthy food outlets such as full-service supermarkets, community gardens, farmers markets are significantly lacking and are difficult to access, particularly for residents who lack public transportation or private transportation. We would like to express our support for developing policy solutions to the obesity crisis that address the excessive availability and convenience of unhealthy foods in communities like South LA. We also encourage the community to consider assessing a tax on soda and certain other unhealthy foods and limit advertising of these products, particularly near schools and other places children congregate. Taxation on tobacco and restrictions on the placement of tobacco products in stores and advertisements have proven effective at decreasing use. However, policies designed to discourage and reduce the consumption of sweetened beverages and other unhealthy foods must be part of a larger, more comprehensive obesity prevention and reduction strategy that also seeks to increase access to healthy food, as well as providing education and outreach on obesity prevention and reduction. Revenues from a tax should also be used to support these activities, just as tobacco taxes have been used to support tobacco cessation activities. We've been working on these issues for many years, and we encourage you to reach out to us if you have any questions or need help. Thank you so much for calling this hearing.
Thank you.
Hello, my name is Caseyvard, and I'm a family doctor. I'm here representing the California Academy of Family Physicians. The California Academy of Family Physicians would like to take a lead role in reducing soft drink consumption. And as you may remember, we were a sponsor of SB 12, which was signed in 2005, that's banning soft drinks in public secondary schools. As a primary care doctor, one of the most heartbreaking parts of my job is to see obese children and adolescents every day. In my practice, it seems like the norm rather than the exception for children to be overweight. And these kids are suffering from old people diseases that their grandparents suffer from. It's an exasperating problem. These kids' chance of a healthy life seems extremely bleak to me, and we physicians need help as well. So the Academy would like to support any type of policy change that goes against obesity. Thank you very much.
Sorry. Good afternoon. My name is Ramiro Cruz. I'm a machine operator for Coca-Cola Bottling. As a second-generation bottler, I'm certain and reassure you that Coca-Cola's formula has not changed.